student nurse at Cedar Crest College, and I did my research project on pressure ulcer prevention in the hospital. So the problem with pressure ulcers is that they happen far too often, and nurses are the main care providers for patients in the hospital. So the first thing we do when we do assessments is look at their skin, and this shows a lot about the patient's health status. So pressure ulcers place a large liability on hospitals and healthcare facilities. And since nurses are the first line of defense in treatment and prevention of pressure ulcers, we must see what are the best interventions. So patients at risk for pressure ulcers are suffering from impaired mobility, impaired nutrition, medical conditions with large comorbidity like diabetes, and the elderly. The cost for one full thickness pressure ulcer is about $70,000, and with the occurrence of about 2 million people per year in the United States alone, the amount per year is almost $11 billion for just the U.S. alone. Medicare and Medicaid will not reimburse hospitals if the patient acquires a pressure ulcer. Many patients are Medicare and Medicaid, so this is a huge problem for hospitals. Patients with pressure ulcers are typically there longer, and they have an increased risk of infection and increased risk of mortality. And the big thing is that they are preventable, and it's considered neglect when hospitals, when patients come to the hospital without a pressure ulcer, and then they acquire one there. So the research question is, what are the most effective nursing interventions to prevent skin breakdown in at-risk or elderly patients in the hospital? So I did my literature search here at Cedar Crest College in the library and at my home in Stewartsville, New Jersey. I looked for full-text articles with the databases of CNOL, Google Scholar, Sage, and PubMed. I found Google Scholar and CNOL the best databases for this topic. Sage and PubMed were okay. I didn't find as many there, although I did find some for the search that I found okay to answer my question, but PubMed was more medically based. The keywords I used were skin integrity and hospital, pressure ulcers and nursing interventions, skin breakdown, pressure ulcer, and nursing. I narrowed all the articles down to peer-reviewed articles and limited the time frame from 2005 to 2013, except for 2 articles which I did find that were a little older. Narrowing it down to just one article from 8 to 1, I omitted the first 2 articles, which were the oldest. The one that from PubMed that was medically based, I omitted that one. There was one that was about elderly hip fracture patients, and I found it would be a little difficult to critique, so I took that one off. One based on documentation, because it didn't really conclude anything, and that it would prevent pressure ulcers. And then I had 3 articles left to choose from. So the last one I eliminated was about skin color, and then the second one I eliminated was on the effectiveness of turning patients. I felt it was a little too narrow. It would have been hard to critique. And then the study I chose was called Wound Care, Reducing Hospital-Acquired Pressure Ulcers. It was by authors Chicano and Droll-Shagan. I picked this one because it didn't just have a study on nurses, but also patient care technicians who are a huge part in patient care. So the study design was descriptive, quantitative, and KC experimental, and there was no framework identified. Now the sample was at a hospital in Winfield, Illinois. It was Central DuPage Hospital, and it was in the year 2006. It was at a 25-bed intermediate care unit where the patients were too sick to go to the general nursing floors, but not sick enough to be in the ICU. So this unit experienced 6 pressure ulcers from year 2005 to 2006, and then 5 again from the year 2006 to 2007. These were all hospital acquired on their unit. So they were motivated to fix this problem. So the Quality Council made a skin assessment for the nurses and the patient care technicians about skin assessment and survey. So 70% of the staff responded to this, and what they got out of this was that there was a variable difference in how they practiced and how they intervened with skin assessment and taking care of the patients with skin problems. So there was 3 phases. I'm going to go through this quickly. The first phase was over 5 months. It was based on skin assessment and documentation. The patients were screened on admission within 8 hours and every shift. If there was a declining condition, the physician was notified, and the wound and ostomy care nurse would come in and assess. So then a standard repositioning schedule was put in place. The compliance was 92%. Phase 2 was over 3 months. It improved the method for documentation with the braided scale. Things would pop up if their scale was lower than 18. And 99% of the RNs approved, and there was a 99% adherence. Phase 3 was over 15 months. It was a revision of the use of the TED stockings and the SCDs or Venadines. They were made to remove them twice a day, do a skin assessment, and provide care. So the results were that their overall goal was to only go from 5 hospital-acquired to 3, and only 1 occurred that year. So this was a big change. So the limitations to this was the sample size. It was just a small unit. It made it difficult to find significant relationships from the data. The lack of available and reliable data was another limitation, which made it difficult finding a trend and being able to relate to a larger group. The self-reported data, it was just from employees in the hospital. Staff participation and adherence. The initial survey, only 70% of the staff member participated, and continuous education, training, and self-governance was needed to keep this project going. So the conclusions, what are the most effective nursing interventions to prevent skin breakdown in at-risk or elderly patients in the hospital? The following needs to be in place: communication, quality improvement, teams and staff adherence, correct documentation, protocols, and standard practices of turning and SCDs and TED removal with skin care. And these are the references I used. Thank you so much for your time.